Hey ho, let's go. My name is Dr. MarkAlain Dery. I'm Medical Director of Infectious Diseases and Chief Innovation Officer for Access Health Louisiana. I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. Welcome to our public health video blog. And while you best know the ACOI, hello ACOI, as the place to turn to for quality CME for physicians, both online and in person, the ACOI has been working diligently to keep you up to date by sharing updates on the ongoing COVID-19 saga, as well as expanding our coverage to include other public health concerns as well. Hence, I offer you this regular public health perspective. Today, we are going to be talking about nutrition, hunger, and public health. I think these are very important topics for us to consider. So most of us who work daily in public health would agree that public health is not just an elimination of certain diseases, but more about the entire spectrum of health and well-being. And on that spectrum is nutrition and diet, food insecurity, and access to healthy food, as well as the role that fast food and processed foods play in the rise of chronic diseases. Now, heavily processed foods that are high in sugar, fat, and empty calories. For example, consuming lots of these foods have been linked to increased risks of a wide variety of health problems that can lead to heart disease or to other conditions like obesity, like high blood pressure, like elevated cholesterol, cancer, and other mental health concerns like depression. So it's no surprise that there's a direct relationship between poor diet and the growing epidemic of chronic diseases. Now, another school of thought on the impact of ultra-processed foods is how the lack of micronutrients in these foods influences mental health symptoms like irritability, explosive rage, and unstable mood. And there's evidence in multiple studies that individuals who eat a healthy, whole food diet actually have less symptoms of depressive disorder and anxiety than those who eat processed foods. Wow. And considering that we are living in a more explosive society, overall, with increased rates of gun sales, social media pressures, 24/7, nonstop news cycling, and bullying become mainstream, even seen within the chambers of our government. The effect of what goes in our bodies is exacerbating this troublesome trend of a distressed and angry society. Consider that in the United States, 67% of what children aged 2 to 19 years old consumed, and 57% of what adults consumed in 2018 were ultra-processed foods. Ugh. Also consider that Black Americans are more likely to be obese in the United States than white Americans. This is also true for Latin Americans. The rise in obesity in the United States is an epidemic and is much the root cause that can be found in poverty, a condition that is more prevalent in communities of color. Of course, this has everything to do with structural discrimination that exists in our society. So why is that? Why do we see this happening? In some parts of it, accessibility and marketing are huge factors that go into this. A study several years ago found that fast food chains in predominantly Black neighborhoods were more than 60% more likely to advertise to children than in predominantly white neighborhoods. And fast food locations, in fact, are strategically placed more prominently in neighborhoods with larger populations of non-white residents. And as expected, children who eat fast foods tend to eat more calories. This means more fat, sodium, sugars, and less of the good stuff like fruits, vegetables, and then dairy. Eating fast food has also been found to cause higher body fat and insulin levels in adolescence and increased risk of obesity in adulthood. And another public health risk related to diet and poverty is the rising rates of hunger and food insecurity. In 2020, over 38 million Americans lived in households that struggled against food insecurity or lack of access to an affordable, nutritious diet. That's nearly 10% increase from 2019. And in terms of race and ethnicity, nearly 22% of Black households and 17% of Latinx households were impacted by food insecurity, which tripled in 2020, by the way. In terms of geography, that food insecurity is highest, of course, right here in the South, followed by the Midwest, the West, and the Northeast. So what can those of us who serve our patients do to help slow or reverse this trend? Okay, Well, for one, consider how important it is to get behind income support as a health intervention. So important. We all agree that household food insufficiency is not only a material hardship, but it's associated with adverse health outcomes. A study found that the recent child tax credit, which ranged from $250 to many times that, depending on the number of children and the ages of children, was associated, ready for this, with a 26% reduction in food insufficiency nationally amongst households. That child tax credit, which was precipitated by the COVID-19 pandemic as part of the $1.9 trillion American Rescue Plan, which passed in March of 2021, it has created a form of income support that is having a positive health outcome of less hunger. That's a great result of this troublesome time. Unfortunately, if I know, or if I heard, I think that tax credit may have stopped, and we need to make sure that continues. I have heard that it also reduced poverty by like 50% as well. What else can we do? Well, as physician, and by the way, if we can reduce poverty by 50%, well, then that means 100% could be right around the corner. What else can we do? Well, as physicians, we can play a critical role in identifying and addressing our patients' food insecurity by screening for social determinants of health and adding food insecurity to the discussion we have with our patients. We can make referrals to community resources as needed, in addition to the tips found in the Food Insecurity Toolkit published online and found in the link below. The food insecurity screening and referral process consists of 5 steps: identifying patients who live in food insecure households, connecting patients with proper resources, considering clinical needs that result from food insecurity, following up with the patients at their next office visit, and lastly, measuring the impact food insecurity interventions on patients who have food insecurity and what the impact that has on their status and health. Remember, to add food insecurity to a patient's problem list, you can use the ICD diagnosis code of Z59.4. That's Z59.4, which is lack of adequate food and safe drinking water. We can help patients connect the dots that access to the role healthy foods play in managing their health and to encourage them to let us help them. Again, for more information and a food insecurity toolkit for physicians, refer to the resources on the blog page at the ACOI site at hungerandhealth.feedingamerica.org.link. Nope. No. Let me do this again. hungerandhealth.feedingamerica.org. And in the future, please stay on the lookout for these updates. And to read more from the sources used in this report, go to that's acoi.org/resources. Oh my goodness. Together with the ACOI, hello ACOI, thank you. We'll help you have the latest information to help you respond to your patients. Please feel free to reach out to me at any time at madery@mac.com. Please stay safe. And as always, thank you to Gina Kilker for another brilliant script.